welcome you to the show. This is George, and here we have a professor in the lab. Yes, he was going to introduce himself so we can proceed with the show as before. So, Professor, please introduce yourself.
Thank you so much. As you say, Zoonotic is my name.
Okay.
I work in the laboratory. Welcome for the show. We're going to talk about some health issues which will be of help to the policy. Thank you.
Okay. So, you will help me there, and we're going to increase the volume a little bit. So, today we want to ask a few questions about what is this malaria. It's very, very rampant in the country as of now. So, I wanted to ask you a few questions about malaria as a disease and what is it you do here when it comes to malaria. So, we can start?
Yes, please.
Okay. So now, I want to ask, could you explain to us what this malaria really is, in your understanding?
Malaria is a parasitic infection caused by a parasite called Plasmodium. Plasmodium as a parasite has in its species, and there are about 4 species which cause the malaria disease.
Oh, so you were trying to say that it's not just one.
No.
There is a number of different species.
Yes.
Okay. Proceed.
With the most common species known as Plasmodium falciparum.
Okay.
And then we also have Plasmodium malariae. We have Plasmodium vivax and Plasmodium ovale. Ovale or ovale? Depending, tomato.
Yes. Okay.
So, like I said, it's a species. This is a parasitic infection caused by a parasite. And Plasmodium is just a scientific name of the parasite. So as to confuse you when I
Yes. You've given us a good explanation, because we have this whole issue about bacterial infection and what's it called, very many types of infection that they tell us when we go to the hospitals. Now, at least you've told us this is a parasitic infection. Okay, now let me ask, which tests do you do in the lab? Because we know you are very good with the lab, isn't it? Yes, we call you professor, isn't it? Yes. So now, we want to know, which tests do you do in the lab that help you find this specific malaria in patients?
Before any test is done, a patient or a person who feels unwell first goes to see a doctor.
Okay.
And this doctor will take history of the patient. And when the history suggests that this person could be having malaria, of course, malaria presents with symptoms.
Yes.
Some of which are fever, headache,
vomiting,
stomachache, vomiting, which look similar to also other infections. We can talk about UTI, also present the same.
Okay.
So when the patient comes with those complaints, the doctor will suspect maybe this could be malaria. Then he sends the patient to the laboratory. So in the laboratory, we can do a number of tests to diagnose malaria or to look for malaria or to confirm malaria. And one of it is a rapid diagnostic test, which looks for a specific protein which is found in the parasite, the Plasmodium. So this RDT
we have it here. We have it here.
Yes. So this is called malaria antigen for Plasmodium falciparum.
Okay.
So that means it looks for the antigen which is inside the parasite, the Plasmodium falciparum. Yes. This is the most common we use. We can also do microscopy. We can make a blood smear from the finger stick, the finger prick. We make a blood from the fingerprint. And then we put on a slide, and then we stain with some dyes, and these dyes enable us to look for the actual parasite how the parasite looks like. We can
So,
see
so
it
you're
with
trying to
microscope.
tell me that you can see this parasite with the naked eye? You can
No.
see it. Hey.
Not with the naked eye,
Eh.
but we use a microscope.
Oh, this big machine
This
here.
big machine here.
Okay.
It's very good. It has lenses.
Okay.
You can turn around and then each lens has its magnification. It multiplies the view of the parasite by 100 times. So if you multiply something by 100 times, it gives bigger.
Very, very big. Yes.
Yeah, but actually these are very small parasites, so we can see the brain of this machine. Yes.
Okay. So now you can use the microscope, this one, and these kits that you have showed us, right?
Yes.
Very, very true. That is very, very good information. Now I had a question. Let's go back a little bit. You talked about symptoms becoming like looking like UTIs, and we've seen very many UTIs as well. So now we need to confirm this. So the lab is the one that actually tells us what the problem really is.
Exactly.
Okay.
The laboratory is the center.
Okay.
The center of health.
Oh.
Like I said, patients present with the symptoms.
Yes, different
And
symptoms.
different symptoms, and these symptoms are alike
Okay.
for different diseases. Like I said, malaria presents like
UTI.
Sometimes somebody who has UTI comes in, I have malaria, most times they say Musuja.
Yes, I said Musuja, yes.
That is it. Because they look similar.
True.
Now it's now the laboratory to get the difference. Is it from malaria, or is it from UTI, or it is something else? So that's why
the lab is very, very important.
Very crucial in health.
Okay. So I think for now, let's just take a very small break, right? And then we'll